Hi YouTube, so Elizabeth back again, also known as Nurse Sabe, here on YouTube and Instagram. And for those of you who are new viewers, welcome. My name is Elizabeth. I am a labor and delivery postpartum nurse and a certified childbirth educator. Today, my video is going to be one that I've gotten a few requests on, a few recommendations to film, and that is going to be on the novel coronavirus, or COVID-19 as it's otherwise known. So I'm not going to make a video telling you guys all about the coronavirus. I will link a really good video down below that I think does a good job of explaining everything about this novel coronavirus. And I want to apologize if I use the term coronavirus in exchange with COVID-19 or novel coronavirus, because coronavirus is a whole host of different viruses, and the novel coronavirus, this COVID-19, is just one subset. So I apologize if I use those interchangeably. I'm trying to be really concise with my language, but sometimes when you're talking, it doesn't always work out as planned. So I want to start off this video by saying very, very clearly, and I already said I'm a nurse, I am not a doctor, I am not an epidemiologist. I am just somebody working in the healthcare field who is dealing with how we are figuring out how to deal with this new infection, and how we are figuring out how to give supportive care and treat patients who come in with severe respiratory conditions because of this new infection. Also, I want to say, while I am not a doctor or an epidemiologist, I'm getting my information from the current policies and procedures that we are enacting at our hospital, and also from the American College of Obstetrics and Gynecology, who just put out a practice bulletin update 2 days ago, I believe. So this information obviously is subject to change as we learn more about this new virus. So with all that being said, I'm going to give you 5 things that your labor nurse wants you to know about the novel coronavirus. And I also just want to say that this video is filmed on March 15th, 2020. I'm hoping to upload it later tonight. So that kind of gives you a frame of reference. So 5 things that I want you to know. Number 1, and first and foremost, I want all of us to sit together and take a deep breath in. Blow it out. Okay. Calm down. This is super anxiety provoking for everyone, and obviously we know that social media is making that worse, and the media in general is profiting highly off of coverage of this novel virus. But we need to be alert but not panicked. And while this is being called by the World Health Organization a pandemic, it doesn't mean that we immediately need to start panicking, because panic is not good for anybody. It's not good for you and your baby, for you to be stressed out. It's not good for the irrational decisions that people make when they are panicked. So taking this on with a nice deep breath when you're getting overwhelmed, taking deep breaths in labor when you have a contraction on, that same deep breath is a great way to welcome that contraction for all the work that it's going to do with your body. With that being said, here is kind of what we know as far as the novel coronavirus and how it affects women, particularly women who are pregnant. So it has not been seen yet that it is particularly aggressive towards pregnant women, or that it is particularly causing severe complications in pregnant women. But that being said, we know that other respiratory illnesses like influenza and SARS do affect women more intensely when they are pregnant. It makes them an at-risk population. So we are treating pregnant women as an at-risk population because of this, because we have seen that these respiratory illnesses can affect women more strongly when they are pregnant. From what we have gathered up until this point, it does not seem like this virus passes through breast milk, which is good. We love breast milk. We love passing antibodies to our babies, and the virus does not seem to pass through breast milk. We also have not seen transmission through the placenta that we've been able to quantify or really visualize and know that that is how a baby would have contracted the illness. So that being said, being a pregnant woman might put you at higher risk. having a newborn, obviously with their lowered immune response, can put them at a higher risk. So practicing social distancing at this time is definitely encouraged. It's being encouraged by the CDC. That's why everything around you is being canceled. Staying in your house with your immediate family, going outside of your house, even out in nature is fine. Going for a drive, but not going to a movie theater or a concert. Working from home if you are able to. Obviously, hello right here, not able to work from home. All things that can be helpful. Practicing good hand hygiene and not touching your face are really important, which is what I'm struggling with currently, but I'm really trying to be cognizant of not touching my face, because the virus, if you have it on your fingers, can't get through your skin. It doesn't have feet, it can't walk, but if you have it on your fingers from touching things, haven't washed your hands, and then touch your face, well, the virus is like, hey, thanks, now I'm where I want to be to cause a respiratory issue. During this time, as our information on the effects of the COVID-19 on pregnant women and babies is evolving, our policies and procedures are going to be changing to reflect that. So it's really, really important that you are keeping in touch with your obstetrician or your midwife and whatever policies and procedures they're changing in their practice, specifically with prenatal appointments, whatever policies and procedures are changing at the hospital or birthing center where you will deliver. Because of these changes, because of the fear of going into a hospital, some women have been considering switching to home births. It is not my place to advise you to have a hospital birth or a home birth. That is a decision that you need to make with weighing the pros and cons of both, talking with your provider, talking with a midwife to see if you're a good candidate for a home birth, talking with your partner to see if that's something that you would want to do together. I had one comment asking me to make a video about how to safely deliver at home. That is out of my scope of practice. I'm sure you can find other videos and other reliable sources to get that information from. I don't really think that we're there yet. But having an open conversation with your OB and your midwife about how practice is changing is really important. The third thing that I want you to know, and this goes back to that open line of communication, before you go into the hospital for whatever reason, and I said this in my 10 things your labor nurse wants you to know, and I'm reiterating it here because it's even more important, please, 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 please contact your OB or your midwife and have a phone triage session with them. If we can avoid healthy people going into the hospital and perhaps getting sick and bringing that illness out of the hospital, that is advisable. So the less that you are in the hospital, the less time you're in the hospital, the better, especially if it is for something that can be treated remotely, ruling out labor over phone, things of that nature. So please, 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 please contact your OB, particularly if you are coming in with signs and symptoms of a respiratory illness. So cough, fever, shortness of breath, especially if you've had recent international or domestic travel or a reason that puts you at a higher risk to think that you could have contracted the novel coronavirus, because the hospital is going to have a way of making sure that the other patients and the staff are safe in that situation and working on putting you, if you are at risk or have a presumptive or known case of the novel coronavirus, in isolation from the other patients and making sure that we're using our proper protective equipment when providing you care. Policies and procedures are going to be changing in the hospital in these coming weeks to account for illness and to try and keep illness away. So at our hospital right now, we have a 2 visitor policy for your entire stay, and nobody under the age of 18 is allowed to visit. And honestly, like, it sucks. Like, it's not ideal by any means. If your older children can come visit your new baby, if you're having to choose between having your mom or your doula there, I get it. It absolutely sucks. It is what it is. We're dealing with it the best we can. I recently saw the doula post about doing virtual doula sessions, which I think is great, where you could FaceTime her during labor, unlimited text and email conversations. So figuring out ways to work around these new limitations to try and keep everybody as healthy as possible is going to be what we're doing in the next few weeks. And so something to kind of follow along, limiting visitors in the hospital it might not be a bad idea. In fact, it's what I personally would do to limit visitors when you go home. Obviously, your immediate family who lives with you will be there, and that's fine, but I really wouldn't have any other people come to visit. And if you have a pushy person in your life, have your doctor write you a note so that you can say, hey, my doctor says I can't have visitors. Sorry, Great Aunt Bertha. And then the pushy person hopefully will back off, because our main goal and objective here is to keep everybody not panicked, happy, healthy, safe. Those are my main goals for most situations in healthcare. So I hope this information was helpful to you guys. Definitely, you can leave questions down below. I'll do my best to answer them, find answers for you, or lead you in the right direction to find answers. Thank you so much for watching. Bye, guys.